Hello, everybody, and welcome. For everyone who is new, this is Oral Pathology 360, and you're welcome to our Tuesday's live stream. This week, we are going to talk about uh, empathy, and it's a big thing. Empathy is currently the one thing that, in a recent survey, most hospital CEOs have said it's on top of their list for what needs to be done and what they're going to be working on. Now, I would think that this is really all my own thoughts, so please just add in whatever you can think of. And I hope we will have a good collection and a good process at the end of this. Now, the what I find is that really it is true that we need to work on empathy because at the beginning of each day, so many patients, so many individuals, sorry, even I did it, but so many individuals go enter the healthcare system, either in a clinic or in a hospital. Um, and they all come in as individuals, and almost immediately they become patients, where afterwards they are just the gender and age. And very often by the end of the day, they once some diagnostics and tests have been done, now they are just a disease. There's so and so disease or so and so illness, and we have already more or less forgotten that, or that there is a person behind all that. I do understand that part of the reason we don't refer to people by their names is the essential part of being the privacy that's required, of ensuring that patient's identity is not vastly known or linked to the disease that they have. But nonetheless, within the system itself, I think it's very essential that we keep the humanity in place. Because if we don't, then that is where we have a problem. And as diagnosticians, we are essentially the first line. Now, I do know that even if someone is performing a clinical exam, that's also diagnostics. But let's talk about the more focused diagnostics, what happens in a lab or what happens in an imaging study. I know there are a vast range, and I'm not going to try and name them, but we generally get the idea of what diagnostics is. And we are the first people to interact with all these individuals. Very often, though, we don't really interact. They become just a piece of paper, a requisition form, a sample is collected in whatever form, or an X-ray or an image is taken in whatever form, and the doctor, is just reporting it, and the report goes out without even really meeting the patient. But because of the placement we have, because of the time we have with patients, and the fact that we are placed at the beginning of their journey in the healthcare system, I believe we can really make a lot of difference. We can put an end to this thing where patients become pieces of paper, and we can literally interact with them. And that would then make us a real part of the whole system in a more complete way, rather than where we are just, like a point of touch and, you know, what I would say, a data point that is collected from the patient, and the patient moves on, and then we are lost in that context. Now, when we think about a patient's journey, and of course, one thing we do remember that very often these times that patients spend in diagnostics can be actually quite long, depending on how much time it takes, how complex it is. And it is only at the end of all these tests that there is an actual interaction with a clinician who will then tell them, okay, this is a condition and this is a treatment, or hopefully tell them that there's nothing wrong with them and they're fine. Although that normally happens much faster than a long gap. Now, in all this time, these patients just going through tests, maybe, but they, of course, have worries, they have fear of pain, they have various apprehension of what they could be having. There is the cost, and there are so many other things that are going through their mind and through their life as it's happening. So, sorry, going to my notes. Okay. But what is, we can change this whole scene by empathy. But then what is empathy? Empathy is essentially when you see someone and you are able to see what is happening to them in their own context and then feel what they feel. Now, this is a very important point to remember. So, you have to see it in their own context and feel what they feel. So, if I'm performing a test, let's say I'm doing a venipuncture or collecting blood, in other words, and the patient tells me they're scared of the needle, now I have to see that needle from their context. I have to see it from their context, not my context where I'm really used to it. I mean, like, what's a big deal? Yeah, it's just a syringe, just a needle. And so I have to see it, see that needle or that test from their context of how it looks to them. To them, it might be looking like a mighty huge needle, and also feel what they feel, which means not what I feel when I think of, say, a venous prick. I have to think of what that patient is feeling. So let's say we have this uh, John who's come to us for a test. And yes, I'm using a male to break down those standard preset ideas that men have to be not scared. They can be also scared. They can have various phobias, and phobias are very real. So, and he says that he's scared. Now, if I'm going to say that, oh no, it's a small thing, it's all right, because that's what I think, that's not going to work. Now, this was just an example of what empathy can look like and what empathy has to be. So, it is essentially seeing what a person is feeling, is seeing in their context, and feeling their reaction again in their context. So, what can we do? How can we really bring empathy? We are so busy, there is so much happening. And I think that's exactly it. The first thing is we have to get beyond those limitations and say, uh, yes, there's a person. We have to interact. We have to say, hello, I'm Dr. So and so, I'm your doctor, or I'm your technician. I'm going to be doing this test. How are you feeling today? Because without the interaction, that is the human part, we will never be able to empathize with them. It is practically impossible to empathize with a piece of paper or a requisition form. Now, while as human beings we are extremely intelligent and emotionally advanced compared to all other creations, but we definitely are not that advanced. Now, we can feel and we can empathize even with our pets, with animals, but that's because we can actually see them. We can see their emotions probably through a sparkling eye or a wagging tail. But without seeing another human being, without actually taking the moment to interact with them, we are not going to be able to empathize with them. So, interaction is very essential. And I think it is also what is eventually going to make it a point, so that if ever we are replaced by AI, at least the individuals that were otherwise interacting with us, at least they will know and they will miss us because they say the human touch is missing. So, this is about the interactions. The first thing to do is interact. And I would again like to say, I would love to hear your thoughts as we go along and let me know what you think about this. The next thing is to inform. Why are you doing the test? What is the test about? What will it show? And this, I think, will be very helpful, especially for our young colleagues and students, because if they are not able to actually explain why, they probably should not be doing the test. We should first be finding out what the test is going to do and only then go on with it. So this helps. And because Very often, we have found, or it's been found that we human beings can tolerate great deal of discomfort and pain if we know that it is for a cause. So if we know that this test, although very difficult and very painful, is going to really make a difference, a specific difference to the outcome of our treatment, to finding what is wrong, we will be able to bear it much better. So that's another thing. Inform the patient really about what the test is about. Then, of course, is acknowledge the fact that it could be very difficult. I mean, and it's okay to say, I can never understand just how afraid you are because I'm not that afraid, but I can understand that you are afraid or that you are in pain or that the cost is too much for you. It's okay to say that you understand because that makes them realize that we are thinking this through. It's not just, an accident of things happening in a certain format because they always happen. No, we are taking the time to pause to think it through, their discomfort, their problems, and therefore we are considering all of these things. So acknowledging that is also a very good thing to do. Then coming to understanding, because we got to understand what a test is, from their perspective. And perspectives change, especially while the test, any test that we do, of course, has a fixed procedure. And that doesn't change. At least it shouldn't. The procedure is the same wherever you go, whatever you do. But a lot of other things change. The person doing the test changes. So on that day, if someone is feeling depressed, feeling upset, is not well, that I'm talking about the person who is performing the test, then that's going to make a difference to the patient because probably they will not be able to give their best and maybe a little short, maybe a little, what should I say, irritated from before and not able to have the required patience. So that makes a difference. Even the level of skill of the operator makes a difference and is different. So the same test in different people's hands can be different. And this would be best if when we see that a patient is very scared or maybe in great discomfort, we see that we put our best person on that. Now, especially in teaching, I know that everybody has to learn, but this is where we have to apply some level of discretion and maybe keep those learning points and learning moments for a patient who is not that disturbed or who's not that much in pain. And another thing, of course, is the context of what that patient is feeling that day. Actually, a part of the reason I thought of this whole thing was my own recent experience of going through the hospitalization and the treatment. Now, I went through a double valve replacement because I had a childhood heart problem, and for 40 years, I have been going through tests. I'm comfortable in hospitals, obviously comfortable with things like chest X-rays. But the day when I woke up in the hospital after my procedure, and I found a chest X-ray almost invasive because I had numerous pipes coming out of me and IV lines going in me. My chest had been opened, and it was literally painful and it was literally scary because sadly, at least one of the technicians was particularly careless. So, this is when I began to realize that we normally don't think much, about an X-ray, asking someone to take an X-ray. We think It's about as non invasive as it can get. What could, I mean, we really don't think about it. Even I've never really thought about it much, I must say. Think a lot more about maybe things like a biopsy or a blood test or even a clinical exam, because obviously we are poking and prodding, and the whole idea is to identify things like very often whether there is tenderness. So obviously we know we are going to be causing some pain, and we think about that, we try to be careful about that. But again, that was the day I realized it's the context, and it's a patient's context of where they are at that point in their life, what is happening to them, what is the scene. So all of these are again things we need to be mindful of. And another thing, of course, also that changes is the machinery. Not all machines are built equal. So when you think about it, sometimes, and I think one of the best examples I can give for this is maybe a CT scan. Now we know, of course, as you go through the CT entry, you need to be as still as possible. And this can be actually quite a problem, depending on how long it takes. So maybe if you have, say, a patient who you know is in pain, severe discomfort, and has to go through a CT, and you can't avoid it, of course, but you can find the machine in your neighborhood that's the fastest, even if it is not your own machine. And I know this can be sometimes a little difficult, but it's finally about the patient. And that patient will definitely appreciate it if you explain to them that yes, you are not well, and this is going to take a little longer, say, in our machine than the one so and so place or in the XYZ place. So we would suggest you go there because we don't want to waste the test that's being done. Now, these are, of course, just some offhand examples I could think of and I could come up with to say what could be done, how we can be mindful. And essentially, to sum it as one is just become a person to the patient. Don't remain somewhere behind a wall where the patient doesn't even know whether the person signing the report eventually is a doctor, is a human being, or a machine. Take the time to come out and meet the patient. And remember, just because someone is a patient, all pleasantries and all normal, what I would say, the normal ways of us as humans do not have to be suspended. It is so often that patients complain that, doctors come, examine me, and I mean, it's happened to me also. They're talking about the patient right over the patient's head and not interacting with the patient. That's really not nice. And it's something we can work past. Now I know you cannot really, when you have hundreds of tests to finish, you cannot really take the time to have a long chat with everybody. And maybe you don't have to personally. Maybe you just have to see in your lab that the person who is interacting can always go and say, "Listen, I'm so and so. I'm a student, or I'm a PG, or I'm a technician. But Doctor so and so is going to be eventually seeing the report. If you have any queries, you can talk to them." And we can also see that everyone in our lab or in our unit, in our imaging unit, is capable of actually explaining to the patient what the test is, how it's going to be done, what are the results. And of course, taking the time to understand that this is all difficult for the patient, this is all new for the patient. We may be very comfortable in our surrounding with our big machines, with the things that we do. For the patients, it is all new. Even being in a clinic or in a hospital is often overwhelming for people who are not used to it, let alone anything else happening. So, just taking the time to understand will make the difference. And of course, it doesn't have to stop with just our patients. It also has to go on with our colleagues, our students, our seniors, juniors, anyone we interact with. Everybody's day can be a lot better if we take the time to actually address each other's problems. A test is not ready, a report is not ready. Instead of avoiding the call, pick up the phone and just tell the doctor who had referred it, okay, this is happening, therefore, this will take a little longer time. They will also be happy because they will be able to tell the patient something as to why the test is report is not there. Within your own department also, just take the time, step in for each other. It's sometimes you don't even really need to do anything besides saying, yes, I understand you have a problem or this is difficult at this point. That is very often all that is really needed, as long as it's done truthfully. Okay, it's not good to say someone I understand if you don't. It's because that really shows truth. These are just a few things, and I hope they have been useful, and I hope we can have uh, some interesting discussion with it. Uh, I hope you can put in your thoughts and your queries and your comments in the chat. And definitely, we hope to be able to do more going forward for our patients. Let me see, there are some comments here. Right. Hello, Dr. Osmani. Very nice to have you here. Guru Raj, sir. Sorry, sir. We cannot actually talk on this because the platform is a little more complex. Can you put in your thoughts in the comments and I will bring them here? It will be very nice if you can do that. In the meanwhile, let me see if anything is happening on LinkedIn, that any comments are there. Right. So we have colleagues on LinkedIn also with us, but I don't know who they are. It will be nice if you can share your name. And I also know that we have, sorry, I have this horrible cold that is just refusing to go away. My apologies. So let's see. What has been your experience? Any experience you have had where maybe you were a patient and you felt that you're not getting the kind of treatment, and I don't mean the medical treatment, I mean the human treatment that you should have got. Do you have any thoughts like that? Yes. Hello, Dr. Mitra. And that is my sister, by the way. So, right. It is very nice to have everyone here. I was telling you about my experience on while everyone types in during this time, and I mentioned that the technician was actually very careless and I would say callous actually. What was very interesting is that there was another team who would come, and different days the tests would be done by different people. So another team who would come did the same X-ray, obviously caused essentially the same difficulty in terms of the test, but just because he was patient and he would just take a minute for the nurses actually to move all the lines and to just move me, it was actually so much more bearable. It's the same test and I was in the same level of discomfort, but really just the technician being more caring made a difference. And that, I think, is what would help with everyone and with everything. So let's see. In the meanwhile, while we get some questions or thoughts, let me share this with you. So, in case you are watching us from LinkedIn or you're watching us from Facebook, only some of our videos are actually available there. The majority of our videos, or in fact, all of our videos, are only on YouTube. That's over 170 videos now. It's, I guess, the largest collection of free lectures and videos. And if you scan this QR code, you will go directly to that, so that you will be able to see that. You can subscribe there to the channel. It's free, you just have to hit subscribe, so that you will actually be able to watch all the different content. You can also go to our website anytime, and that's oralpathology360.com. You can see our upcoming events, you can see whatever else is happening, and that's where you can stay in touch with us. So let me see. Right, from Dr. Mitra. From what I have seen and heard, sadly, there are many dogs who forget the oath which they have taken for caring and saving patients' lives by passing of time, and that's very sad. That's true. That is very true. Sorry, guys. Okay, Dr. Nasser, thank you for joining us from LinkedIn. I do not know why there is a problem with the messaging there, and it's nice that you are there anyway. I know it's the middle of the night as usual. Thank you for joining us there. And yes, of course, the whole thing of empathy, and I guess the oath we take and what we owe our patients is very difficult, and things have become really very, very. I mean, we are still not replaced by machines, but sometimes it feels like we might have as well been, because there really is not sufficient amount of human feeling in there. So that is something we really need to work on. I think the greatest through the last 3 years, and on the many lectures we have had, the ones which have been on technology, and especially on artificial intelligence, and before that, robots taking our job and our space. I think the biggest worry that our colleagues have had, and some of our young colleagues who are now entering the field have had, is that we will be replaced by machines. And frankly, that's becoming more and more likely, because machines are able to do the analytical part much faster than we are. And they can be trained to do the work much better, or at least definitely in keeping with us, but much faster. On the other hand, the only thing that machines can't do is to be able to look at a person and say, "What's wrong? You're not looking well. Why are you looking sad? Don't be scared, nothing is wrong." That's something a machine can't do. They are, mind you, getting quite close, because if you interact with something like Chat GPT, you find that they literally, through the wealth of human interaction available to them, they can literally talk to you almost like they understand, depending on the tone that you put in there in your comment. there's a reaction that's almost perfect, nearly perfect. The only thing that's still missing is that they don't get the tone in the sense of the emotion right. But very often I find if you mention the tone you want, they will even get that right. So if you want to say, I want this to sound friendly, I want this to sound jovial, I found this to sound formal, they will actually get it. So really, there's very little left for us to be possibly replaced. The only thing that we have is that we should not allow the human value to be lost. That's the only thing I feel that is really left. And especially for all the colleagues who are very, very worried about getting getting replaced by a machine. This is something we got to think about. Thank you, Dr. Madan. Thank you for being here and your wishes as always. Thank you so much. And we have a comment from Dr. Nasser from the US where he says, sounds great seminar and topic. Money and economics and nepotism in academia covered empathy. Yes, that is sad. Yes, that is true. It does sort of take away from it, but we have to fight. We have to put up the good fight and do what we have to do to get things going. Right. So, okay, we are, it's six, just past six, and I think we can call it a day or an evening. And yes, let's make a pledge as we are watching this and as we are getting together on this and closing the evening that we will remember to take at least one step a day that brings us closer to being empathetic towards our patients. One step a day. May not be too much, but one step a day. That will make a difference. Oh, thank you, sir, for typing. I know this was difficult. So, Dr. Guru Raj Rao says, um, fear is the key. Absorbed by good talk, solved by good talk and less investigations. Remember, our Prof. Kondaji, physician from Manipal, was very close and friendly. He used to cure by words and paracetamol. Yes, that is true, very true, and that's very correct. Sometimes we do overtest, I think, and in fact, nowadays, sometimes there are so many tests done before the doctor even sees the patient. So, yes, it's good not to overdo it. And thank you, sir, for that comment. Oh, Professor Hill, after such a long time, so nice to catch up with you. And yes, hello, I am well, and I hope everyone else also is well. It's really nice to see you. Missed you having, missed your contributions today. I think you would have quite a bit to say for this. And Professor Rao, yes, take care, yes. You too, sir, take care. And Dr. Madan. Yes, you too. Take care. Thank you so much. Oh, Professor Hill, what's up? I can see we need to get together and have a chat. Okay, we shall do that one of these days. Soon, I hope. Right, let's call it an evening. And let me tell you all about the next program that is coming up. And that is, we have yes, we have a career horizons in the coming week, which is about how do you pursue a PhD in New Zealand. Dr. Shelley Arora will be talking to us. She has just completed her a PhD there very successfully. So she will tell us on how you can get in, how what the place is like, and what's life like there, what it costs. And for all of this, we hope to see you in the coming week. Right. Okay. So let's say bye. Have a great week, everybody. See you next week.